Good evening, guys. This evening's topic C is to physicians on, on ending the waiting room era, bringing care home. Two prominent physicians, Atlanta CMO Benjamin Kornitzer and former Senate Majority Leader Bill Frist, are advocating for a shift away from the traditional waiting room model of care, promoting instead home based, technology enabled care for America's sickest seniors. A case study, uh, Jared uh, Flost, or Flows. Their version is illustrated by the story of Gerald Flost, a 76-year-old shrimp fisherman from a bayou outside New Orleans, diagnosed with end stage renal disease, or ESRD, alongside vascular disease, hypertension, and heart failure. Floss faced the burdens of traveling 3 days a week to dialysis center, long wait times, fatigue, and paperwork instead, with training from Monogram Health. Flows, Foss and his wife learned to perform in home dialysis, supported by a virtual care team, remote monitoring, and regular in home visits. Floss's kidney function and all pre existing conditions have improved. He still receives dialysis, but now at home, a model that treats patients where they feel most comfortable. Why this model works. Kornitzer and Frist argue that this approach reduces patient burden by eliminating long waits and travel, improves outcomes by addressing multiple chronic conditions holistically, leverages technology, AI data analysis, and digital platforms to detect risks early and intervene proactively, enables continuous care between clinic visits using remote monitoring and virtual consult- consultations. The broader shift. This this is part of a larger transformation in healthcare delivery. Telemedicine and remote patient monitoring are now mainstream with 71% of U.S. physicians using telehealth weekly. AI powered tools can personalize care, predict acute conditions, and streamline workflows. Pre scheduling and digital portals reduce administrative delays and prepare clinicians for in person visits. The vision Kernitzer and Frist see the end of the waiting room era as not just a convenience but a necessity, a move toward proactive patient centered care that meets people where they are, whether at home, in the community, or virtually. This model could significantly improve access, reduce hospitalizations, and enhance quality of life for millions of Americans. Home first care can replace many clinic waits by combining in-home treatments, remote monitoring, and virtual teams. It improves access and patient comfort, but raises equity and workforce challenges. Quick guide: what it what this shift means and what to watch for. Core idea: move routine and many chronic care services out of centralized clinics into patients' homes using virtual visits, remote monitoring, and periodic in person visits. Key benefits to evaluate: fewer trips and waiting rooms, exposure, better continuity for complex patients, earlier interventions via data and AI. Main trade offs: potential to widen access gaps, require new staffing models, and depend on reliable tech and home supports. What the article reports. Summary: two physicians leaders argue that home based care is no longer aspirational but practical for many of the sickest seniors and people with chronic disease. They highlight a patient case Jared Floss, who moved from center based dialysis to in home dialysis, supported by a virtual care team and remote monitoring, with measurable improvements in his overall health. The authors say modern digital tools, AI risks, satisfaction, and partnerships between players and providers make scaling home care feasible. Why this can reduce waiting rooms, remote triage, and virtual visits let clinicians resolve many issues without an office visit, cutting waiting room time, continuous monitoring, wearable home devices. Flags deterioration early so teams can intervene proactively rather than after after a crisis. Important implementation considerations. Technology and connectivity. Patients need reliable internet devices and digital literacy. Workforce redesign. Clinicians must shift to hybrid workflows, virtual panels, home visits, care coordination, payment and partnerships, sustainable reimbursement, and vendor provider partnerships are essential to scale home based modalities. Risks of widening disparities. Membership concierge models and tech requirements can leave low income, rural, or digitally excluded patients behind. Workforce strain and closures. Some, some clinicians are leaving traditional practices, shifting care homeward without addressing staffing could worsen access in other settings. Clinical safety boundaries. Not every condition is safe for home management. Clear protocols and escalation pathways are required. Practical next steps for health systems or clinicians. 1. Pilot high impact services, e.g., home dialysis, chronic heart failure, remote monitoring with robust outcomes tracking. Invest in care teams, nurses, community health workers, virtual clinicians, and tracking or training for hybrid workflows. Design equitable access plans, device lending, broadband supports, sliding scale programs, and community partnerships. Bottom line, bringing care home can and many waiting room bringing care home can end many waiting room visits and improve outcomes when paired with remote monitoring, virtual teams, and payment models that support equity and workforce sustainability. The evidence and real world pilots cited suggests it's feasible, but success depends on uh, deli- deliberate design to avoid leaving vulnerable patients behind. Okay, guys, here's the next part. Title is The Death of the Waiting Room. Why smart hospitals are hiring chief AI officers. Based primarily on the page you're viewing. Core meaning. The text describes a major shift in hospital operations. AI eliminating the traditional waiting room by turning hospitals from reactive systems into predictive, continuously coordinated environments. To make this possible, hospitals are creating a new executive role, the Chief AI Officer, or CAIO, who oversees the algorithms that run the hospital's central brain. Why the waiting room is disappearing. The surrounding page content lays out the bottlenecks that used to create long waits and how AI removes them. 1. AI triage starts before the patient arrives. AI analysis or analyzes 911 call audio for stress markers. It pulls wearable data, heart rate, oxygen levels, etc. It that it assigns a severity score instantly. High risk patients bypass the waiting room and go directly to the appropriate unit, e.g., cath lab. Low acutely cases are routed to telekiosks. This means the line that used to form at the triage desk never forms at all. 2. AI solves the bed availability crisis. The page describes bed ter- uh, ter- Tetris. Give me 1 second. AI predicts when each patient will be discharged. It alerts cleaning crew 30 minutes early. It coordinates bed turnover with the precision of air traffic control. This eliminates the second major cause of waiting: no open beds. AI command centers replace clipboards and chaos. Hospitals now run centralized traffic control towers where AI monitors every bed, every ambulance, every operating room, staffing levels. This real-time orchestration removes the unpredictable delays that used to ripple through the system. Why hospitals are hiring chief AI officers. The page emphasizes that the C the CAIO is now as essential as the chief of surgery because hospitals depend on AI for nearly every operational decision. The CAIO oversees the algorithms that manage. Give me 1 second. Predictive staffing, anticipating flu surges 48 hours early, supply chain automation, ordering critical drugs before shortage occurs, data flow between radiology, AI, surgical robots, and command center systems. The role exists because hospitals are no longer just clinical environments. They're data ecosystems that require strategic oversights. The tension, efficiency versus overreach. The page also hints at risks. Centralizing all hospital data into one brain raises privacy and bias concerns. The CAIO must balance efficiency with ethical safeguards. This is why the role isn't just technical, it's governance. The headline captures a transformation. Smart hospitals are eliminating waiting rooms by predicting needs, routing patients automatically, and coordinating resources in real time. To run this AI driven infrastructure safely and effectively, they need a dedicated executive, the chief AI officer, to ensure the system works, stays ethical, and keeps humans in control. Okay, guys, that's your C for the night. I will see everybody tomorrow or later for another show. For now, Gator Wellness. Take care, folks.